Good afternoon, and thank you for joining us. I'm Sharon Contreras, the Superintendent of Guilford County Schools. With me today are Dr. Julia Van, Director of Guilford County Public Health Department. To my right, Dr. Whitney Oakley, the GCS Deputy Superintendent, and Michelle Reed, GCS Chief Operations Officer. Our goal today is to share important information with you regarding the science driving our decision to reopen schools, the public health protocols all students and staff will follow, and the contingency plans we have in place to pivot quickly from in-person to remote learning if needed. Before we share these details with you, however, it's important to take a moment and reflect on where we've been, what we've learned, and what each of us can do to ensure the health and safety of our students and staff. As you will hear from Dr. Van, research and our own experience here in GCS and in Guilford County tell us that our students learn best and thrive the most when they attend school in person. Because we adhere to the recommended public health measures, including masking, our schools are also the safest place for our students. We also know that school closures had a devastating impact on our students' learning and on their emotional health and well-being. That's why we're committed to in-person learning and why we will do everything in our power to keep our students healthy and safe in our buildings. That is also why I am so very proud of our students and staff and our partnership with Guilford County Public Health and other public health officials and experts. While words are inadequate to express how challenging the pandemic has been for all of us and how heartbroken we remain over the loss of life we've experienced in Guilford County and across the nation and world, this much I know to be true. We will get through this, and we will emerge stronger and better for it. That's the GCS way. That's the North Carolina way. And that's the American way. To get through this with as few disruptions to student learning as possible, however, we do need your help. We need to mask, we need to get vaccinated and get our boosters if eligible or able. We need to follow other important public health guidelines, and we need to prepare now for possible shifts to remote learning at the individual classroom and individual school level, especially if we experience staff outages like we're seeing in healthcare. And now Dr. Van will provide an update on the science and research behind why it is safe to reopen our schools for in-person learning with the appropriate public health protocols in place. I also want to take a moment just to thank Dr. Van and her team, including our school nurses, for everything they have done and everything they continue to do to help guide us through these unprecedented times. Dr. Van, welcome.
Thank you, Dr. Contreras, for your words of wisdom and for your ongoing partnership with the Guilford County Division of Public Health. I would like to start by saying that children and adolescents can be infected with SARS-CoV-2. They can get sick with COVID-19 and can spread the virus to others. However, compared with adults, children and adolescents who are infected with SARS-CoV-2 are more commonly asymptomatic, they never develop symptoms, or they have mild and nonspecific symptoms. The research is indicating that in-school transmission is different and much lower than in-community spread of COVID-19, primarily because of the great work students and staff continue to do in following public health protocols, including masking, hand hygiene, cough and sneeze etiquette, and physical distancing. A study comparing COVID-19 hospitalizations between counties with in-person learning and those without in-person learning found no effect of in-person school reopening on COVID-19 hospitalization rates. Also, although outbreaks in schools can occur, multiple studies have shown that transmission within the school setting is typically lower than levels of community transmission when prevention strategies are in place in these schools. Detection of cases in schools does not necessarily mean that transmission occurred in the school. Most cases that are acquired in the community and are brought into a school setting result in limited spread inside schools when multiple layered prevention strategies are in place. Another topic I would like to focus on is the Omicron variant. Guilford County Division of Public Health is working with state and federal officials to monitor the spread of SARS-CoV-2 Omicron variant. As of December 20th, 2021, Omicron has been detected in most cases and territories in the United States and is rapidly increasing the proportion of COVID-19 cases that are being reported. In North Carolina, at this time, we are anticipating that all cases that are being reported at this time are with the Omicron variant. This variant is more infectious and spreads more easily than other variants. However, initial data shows that it might cause milder symptoms. We still have a lot of information and a lot to learn about this variant, but some initial concerns are about vaccine efficacy and treatment success. These two main points are very important, and we need to continue to be vigilant. This leads me to my next point about vaccinations. COVID-19 vaccines are safe, effective, and free. We recommend that everyone who has not started the COVID-19 vaccine series does so immediately. And everyone who is eligible to get a booster is doing so as soon as possible. Boosters are recommended for everyone 12 years and older, and more recently, the CDC is recommending that everyone 12 years and older is recommending that for some immunocompromised children ages 5 to 11, an additional dose of Pfizer vaccine is recommended to complete to be added to the primary series for a total of 3 doses. Also, CDC now recommends booster shots at 5 months after the completion of the primary series of Pfizer vaccine for those aged 12 and older. Getting vaccinated and boosted is the best way to prevent serious illness, hospitalizations, and death. At this time, the official definition of being fully vaccinated has not changed. People are considered fully vaccinated 2 weeks after their second shot of the 2-dose series such as Pfizer or Moderna, or 2 weeks after a single-dose vaccine such as Johnson & Johnson's Janssen vaccine. But as you will hear in a minute, isolation and quarantines guidelines have changed, and there is a lot of emphasis that is put on boosters in regards to these new timelines. Vaccinations in association with masking remain the 2 most effective mitigation strategies that we have right now to fight the virus. Masking remains a requirement for all students, staff, and teachers while indoors in Guilford County Schools facilities, and I strongly urge everyone in the community to continue to wear a face covering when in public, indoors, regardless of vaccination status. A study conducted here in North Carolina showed that counties that had an optional mask protocol in their schools had a 3-fold increase in the number of clusters they have reported compared to schools that had a mask mandate. Now I will talk a little bit about the new CDC recommendations. As mentioned before, on December 28th, the CDC came out with isolation and quarantine timelines that are a little bit different than the ones before. The change is motivated by science demonstrating that the majority of the SARS-CoV-2 transmission occurs early in the course of the illness, generally in the 1 to 2 days prior to the onset of symptoms and the 2 to 3 days after that. We are now recommending that individuals that are testing positive for COVID-19, regardless of their vaccination status, are doing the following isolation protocols. They stay home for 5 days. After 5 days, if asymptomatic or symptoms are resolving, they can leave isolation. They must continue to wear masks for 5 days after this when they are at home in the community. And again, I'm reminding everyone that masking is required at this time in Guilford County schools. Testing is not needed to return. When we're talking about individuals that had a close contact with somebody who's positive, so they've had an exposure, and now we're talking about quarantine protocols, This applied to people that have been fully vaccinated and boosted. So this is the part where boosters become really, really important to the change in the CDC guidelines. They can continue to wear a mask at home and in the community, and they need to test on day 5. There is no quarantine needed for anybody who's fully vaccinated and boosted. Everyone that does not meet the criteria above, so people who are not boosted, or if it's been more than 6 months for Pfizer or Moderna, or more than 2 months from their Johnson & Johnson vaccine, they must quarantine. They have to stay home for 5 days, and then they have to continue to wear a mask for 5 days after that and test on day 5. An important point to keep in mind is that if you are mildly symptomatic at this time, and otherwise you do not have any other health conditions, you are not suffering from underlying health conditions, you're not immunocompromised, you do not have comorbidities, presume that you're COVID-19 positive and stay home and try to stay away from others. I would just like to conclude by emphasizing that schools are the safest place for students to be because of the public health protocols that are in place and all of the work that all of our staff and teachers are doing at this time to make sure that our students are following these protocols. Thank you very much, and I would like to now turn it back to Dr. Contreras.
Thank you, Dr. Van. We deeply appreciate the dedication and perseverance you and your team have demonstrated throughout the pandemic in supporting our students and staff. Again, with the support and guidance of our public health partners, we are doing everything we can in GCS to keep our classrooms and schools open for in-person learning. To keep everyone healthy and safe, we will continue to ask everyone to follow the public health protocols we developed in alignment with Guilford County Public Health and the State Health Department's Strong Schools North Carolina Public Health Toolkit, which was updated December 30th, 2021, and is posted on our website. We are also providing incentives for our dedicated substitute teachers and other staff. We provided incentives for teachers and other personnel previously. We met virtually with our principals on Sunday to go over the updated public health guidelines so they can share the information with school staff. In partnership with Public Health, we hosted a vaccination and booster clinic yesterday for GCS employees at 3 locations. We also hosted COVID-19 testing for GCS employees who were experiencing symptoms of COVID-19 or had been exposed to COVID. Starting earlier today, we began offering drive-through testing for COVID-19 for GCS students as well. The testing sites are available to GCS employees and students who are COVID-19 symptomatic or exposed, and these drive-through testing sites are open from 10 to 12:30 and from 5:30 p.m. to 8 p.m. all week. To access the testing, GCS staff should bring their employee ID badge and or a paycheck stub and their driver's license or state ID. Students need to bring their student ID or the name of their school and homeroom teacher. They need parent permission. Again, the drive-through testing is for GCS staff and students only. We are working diligently to begin an optional COVID testing program for staff and students within the coming weeks. We will share that information as it becomes available. While we are doing everything we can to keep our students in school, learning in person, and have contingency plans in place to augment possible staffing shortages, it is possible that some classrooms or schools may have to close simply because we do not have enough people to provide appropriate instruction and supervision. It is also possible that we will not have enough bus drivers to provide transportation for all students to and from school. If you can bring your child to school, please do so. As is the case across the country, GCS is experiencing a bus driver shortage, in addition to pandemic-related absences. We need your assistance in alleviating stress on the system. Please remind your children to bring their devices home each day and keep them powered up. Let your school know now if your child has any access issues so we can fix those right away. If possible, we encourage parents to prepare in advance of any emergency closings. As Dr. Van said earlier, it is also vitally important that students and staff stay home if they're sick or experiencing any symptoms. Keeping everyone healthy and safe is a shared responsibility. While we will do everything we can't do it alone. We need the cooperation of our staff, students, parents, families, and community to get through this current surge as we have through other waves with minimal in-school transmission. Our leadership team has worked throughout winter break to ensure that we could safely reopen our schools for in-person learning and to offer these additional vaccination clinics for our staff and testing opportunities for our students and staff. I deeply appreciate their efforts. I am very proud of our GCS employees, all of whom have worked tirelessly to do what's best for the children. We are so honored and humbled to educate and serve every single day. I am very proud of our students who are listening to the adults and following the public health protocols we have put in place. They are doing their best to learn despite historic disruptions caused by the coronavirus. And I am grateful to our parents and families, which include many of our own employees who are dealing with the enormous pressures and challenges of daily living during the pandemic. We will now take any questions you may have. Ms. Edwards will act as a moderator for this part of the briefing. Ms. Edwards.
So again, thank you. Shoptal has the mic, and please wait for her to come to you before you ask your question. So let me see her show up, okay?
Hi, Dr. Van, just to clarify, those new guidelines, so for students who are fully vaccinated and have their booster shot and are asymptomatic, they're allowed to come to school?
So, students who are fully vaccinated and boosted and they had a close contact with somebody who's a positive, yes, they can come back to school.
Okay, thank you.
Yes, and over here, I want to ask you, Dr. Contreras, what is the percentage of teachers that have been vaccinated or boosted, and what is the percentage of bus drivers?
So I have the percentage of total staff. I can get you the numbers by employee group. I can tell you the number of bus drivers is lower than teachers, but in total, approximately 80% of all employees are vaccinated.
Dr. Van, how concerned are you that some studies are coming out showing that children are more receptive to Omicron, and therefore there might be higher infection rates, and how that could affect the plan to hold in-person classes?
Sure. So just like I've mentioned during the initial part of the briefing, there's still a lot of information that we need to learn about Omicron and how it impacts different age categories, different demographics, or different geographic areas. So as these studies are coming out, we will continue to adjust and adapt our protocols and practices based on the new science and the data.
Dr. Contreras, you mentioned a drive-through testing program. Do you mind elaborating a little bit on what that is?
Could you repeat that?
Sure.
The drive-through testing program, could you elaborate?
Yes, I'll actually ask Ms. Reed to speak to that.
Sure. So we have conducted 3 drive-through testing sites, one at Andrews, one at Grimsley, and one at Dudley. The Dudley opened today, which Grimsley and Andrews was open yesterday. for GCS staff only. Today, we are expanding it to GCS students and staff. Those hours of operation are Monday through Friday. Starting today, Tuesday, we're going to be doing a portion of the day in the morning or afternoon, and then the latter evening to make sure that we are capturing students and staff. Those are outsourced. Company is actually conducting the testing for us. We actually partner with a company to conduct the testing, but we are managing the site.
As we said, we are moving towards a optional testing program for our employees and students with parent permission, and we'll have more information in the coming days.
Hi, did the state change the Strong Schools toolkit, or is this something that you're doing separately?
Yes, the North Carolina DHHS updated the Strong School Toolkit on December 30th. Based on the CDC's recommendations from December 28th, knowing the importance that school administrators and public health departments need to have the guidance and the support as schools were coming back into session this week. So we are following that DHHS toolkit that has been put out just a few days ago.
After the holiday break, is there a rise by any chance in COVID cases that you guys have noticed with the Omicron variant? And that's for anybody.
Sure. So if we're talking about school cases right now, we are not we don't have a whole lot of data since everybody has been during the whole, winter holidays. So we're going to start looking at school cases this week. But overall, there has been a very high increase in cases overall in the community during the holidays. And healthyguilford.com is the best place to get the newest data that we are posting daily on that website that shows all of the metrics that are being captured by Guilford County Division of Public Health.